This is part one of a two-part series for yoga for back pain. I would encourage you to try to do this routine on a daily basis. And then once your back pain and your symptoms are starting to decrease, then start to do part two. And that will really start to build a little bit more strength and get into a little bit deeper and more challenging movements and positions. So this is a very gentle start, and we'll start by lying on your back. So to start, lie on your back with your knees bent. Place your right hand on your belly and your left hand on your chest. And then we'll begin by just taking a few intentional breaths, just feeling where you're breathing. So notice which moves more, your hand on your belly or your hand on your chest, as you lie here and take a few cycles of breath, just starting to tune into the body, observing and noticing the movement of the body as you bring air into and out of the lungs. And then from the breath, start to move your awareness around the body, just doing a gentle body scan, just noticing what you're feeling and where, without attaching any stories, judgment, or labels to that experience of sensation within the body, just noticing. Maybe a particular part of the body is calling for your attention, maybe the low back. Try not to linger on any one part of the body and allow the next sensation to come as the last sensation moves gently out of your awareness and attention. Maybe you start to notice the sensation of your feet touching the floor, your tailbone touching the floor, your back, your shoulder blades, the back of your head in contact with the floor. Maybe you start to notice a sensation of pulsation in the body as the blood pumps through your arteries. Maybe you're noticing a tingling sensation as you feel the prana and the nervous system in their aliveness and their awakeness. And then slowly we will start to introduce some mindful movement. So begin by placing your hands on your hip bones. So you'll feel for that bony part at the front of the pelvis. And just place your hands there. And then push your low back down into the table, doing a posterior pelvic tilt as you push the low back down and almost peel the tailbone off the table. And then you'll reverse that by pushing the tailbone into the table and lifting or arching the low back. And we're just going to move back and forth, doing a posterior pelvic tilt. And you'll feel the points of your hip bones moving up towards your ribs, and then an anterior pelvic tilt as you feel those hip bones, the pointing part of the pelvis, pull down towards the front of the thighs as you arch your low back for that anterior pelvic tilt. And just move back and forth here. And I want you to just tune into your low back and the sensation of movement in the spine, the lengthening and shortening of the muscles on the front and back of the spine as you move through this anterior and posterior pelvic tilt. Just bringing the deepest mindfulness and intentionality and observation to movement that you possibly can, without judging, without labeling, just observing that movement. And if you have pain, maybe you just move a little bit less. Maybe you try with a little bit less effort to force the movement, but you find that availability of pain-free movement. And that goes for everything within this practice. Every suggestion that I offer, tune into your own body and honor what it's needing. And then from the anterior and posterior pelvic tilt, we'll move into more of a windshield wiper type of movement with the knees. So you can place your hands on the floor beside you, palms face down. Snuggle your shoulder blades under you just to offer a little length to the back of the neck. And then allow the knees to rock from the left, moving both of them in the same direction. You'll feel your right side of the pelvis comes off of the mat, and that's okay. And then you'll move the knees windshield wiper style over to the right. And you'll notice now just a gentle rotation in the spine and in the low back as you do this. Just starting to introduce slow and intentional movement, observing that sensation of movement, of the pressure as it rolls across the tailbone from one side to the other, the rotation in the spine, the rotation that's happening at the hip joints. Observe your breath as you move through. You can pair the movement with the breath, exhaling as you twist and inhaling as you come back to center. And then the next time your knees come to center, let them land and stay in this center position. And then you'll grab your right knee, interlocking your fingers over the knee, and just gently pull that knee towards your chest. You can also grab behind the back of the thigh if that's more comfortable for you, and just give a gentle pull to that hip as you pull the knee towards your chest. Take a breath or two here, and then switch sides, and we'll offer a gentle pulling to that left leg as we pull the knee to the chest. And you can do a few more rounds here like this, or another option would be to straighten out the bottom leg, and that just gives a little bit more range of motion at the hip joints. And then when you switch, you'll notice your abdominal muscles engage a little bit to stabilize and control that motion. We'll just do a few of these, tuning in to the breathing, to the breath with the movement. And then the next time that you're pulling your right knee towards your chest, hold for a breath or two. And then use your left hand to hold the knee. Place your right hand on the floor beside you. And then you'll pull the right knee over to the other side of the mat for a supine twist. And you'll take a breath or two here, just feeling into that rotation of the spine, how the breath moves the rib cage while you're in this spinal rotation position. One more breath. And then back to center. Give that knee another hug up towards the chest, and then bring it back down. And then switching sides, now hugging that left knee up to the chest, holding it with the right hand as you place the left hand on the floor beside you. And then gently and slowly bringing that left knee over to the right side of the body. As your left arm comes out, you can flip the palm to face up, turning your head to look past that left arm. And breathe. Breathing in and out through the nose. And then come back to center. Hug that left knee up towards your chest one more time. And then place both feet flat on the floor with the knees bent. Take your fists, bring them behind your low back, And then you're going to use your knuckles almost as like a self-massage so that there's a little gap where your spine, the bony part of your spine, will go right in that gap, and your knuckles are going to go right on either side of the spine as you give yourself a little massage for those low back muscles. So just rolling those knuckles along the spine here. And if you find a spot, if you catch your knuckles on a spot that feels particularly sore, what you can do is just hold that pressure there. And because it's a little tender, your body is naturally going to want to tighten up to protect you against that soreness. But what I want you to do here is, as you find that sore spot, hold that pressure and then use your breath to, especially using that exhale, to just soften and melt into that pressure along that sore spot. And when we're doing this, for the exhale here, you can breathe out through your mouth. And you'll notice there's something about that pursed-lipped, slow exhale through the mouth that really helps to soften those muscles. And you'll feel your body just let go and relax into that. And then if you feel like that part has softened up again, just massaging up and down the spine, and that should just feel really nice on those sore muscles of the low back. You can even lift your hips and kind of get your knuckles onto the spot where your tailbone and your pelvis kind of join with the low back. And there's a lot of muscles that attach here and help to control and stabilize that transition from the pelvis to the spine. And so this can often be a sore spot right around that SI joint. And so just that little bit of pressure plus the breathing with that exhale through the mouth where you're softening and letting go. And then again, working up and down the spine, just allowing those muscles to soften and relax into that self-massage, that self-pressure. And then from here, place your hands on the floor beside you. Snuggle your shoulders under you so that your neck is nice and long. Bring your heels up close towards your hips. Push mostly through your heels, so your feet will be flat on the ground, but most of the weight is going to go into your heels. And then push into the ground with your feet as if you're going to lift your hips up off of the ground. But you can keep your hips down, so if actually lifting the hips hurts for now, start by just pushing down and engaging those muscles that would lift. So think about your glutes, your hamstrings, and your low back muscles, pushing and pulling and engaging to provide that lift, and then slow and controlled release that pressure or the lift. And you can alternate and kind of go back to that anterior and posterior pelvic tilt if things feel a little sore. You can add in a few windshield wipers side to side to just help clear some of that stiffness. And then resting with the knees in the center, place your hands on the fronts of your hips again. Push your low back down into the table just a little bit so that you're flattening out your back slightly, just to make sure you're not arching or resting in that anterior pelvic tilt, as if there was a hand underneath your low back and you're trying to squish it. So you're trying to push your low back down into where that hand would be under the small of your low back. Put your hands on the anterior portion of your pelvis, that ASIS, bony prominence here, and just feeling and observing the pelvis as you lift one leg, alternating as if you were marching. And what you'll notice is that the pelvis tries to dip and kind of rock, alternating. And what I want you to do is, as you're pushing down, feel as if you're engaging those lower abdominal muscles, like pulling the belly button in and up towards your spine a little bit. You can think as if something were about to hit you in the belly and you were bracing for that impact. And you can also think about engaging the pelvic floor and engaging all of those muscles. Now, when you do that march, you should feel a little bit less motion at the pelvis when you do that alternate march. And that's going to work on retraining some of the core control and stabilization of the lower back and the pelvis. So this is a good one to practice. You can do just a few of those, and then you can go back to that anterior and posterior pelvic tilt. You can add in a few windshield wipers if that feels good, just kind of finding what works for you to help clear any stiffness or tension out. You can go back to the knuckles on your low back if you feel like things are starting to clench up and tighten up in the low back muscles again. And just finding a rhythm that works for you, kind of alternating between some of these like feel good, gentle movement, self-massage types of techniques with reintroducing some muscle engagement of the glutes and the core. And then again, we'll do the pushing into the heels. Maybe this time you can lift a little higher. And if you can drive the pelvis up towards the ceiling as you engage your glutes, snuggle those shoulder blades under you to keep your neck nice and long. Hold for a few breaths. And then slow and controlled lower back down. Option to keep the hips down here as well, if that's as far as you can go without increasing any of your pain. And then another round, either just pushing down into the heels or lifting and driving the pelvis up as high as you can without pain. Slow and controlled, lower down, and then a clearing technique of your choice, either the windshield wipers, the posterior and anterior pelvic tilts, the self-massage with the knuckles, or you can do the alternate knee to chest hugging if you feel like that's what relieves some of that tension or engagement of the muscles. After they're engaged, sometimes they might feel a little tight, and we're just trying to clear that out in between each round of making those muscles work. And then we'll go back to this small marching exercise with the hands on that bony prominence of the pelvis, just observing, looking for any motion as you do that marching. And this is just a good practice in interoception or awareness of what's happening within the body, just feeling what's going on. It's like a way of giving yourself a little bit of biofeedback by feeling the pelvis to look for that motion that might be happening, and then practice engaging those abdominal muscles to try and stabilize that pelvis or control that motion of the pelvis as you do that little march. And if this is feeling a little bit too easy for you, you can bring your knees into a 90-90 position, lifting the feet off of the floor and doing a reverse march from here. So you're kind of tapping one foot at a time. And again, you're trying to control that motion here. So it really requires that pushing down, almost as if peeling the tailbone off of the table to engage those abdominal muscles as you work here. You can also keep the feet down and just keep doing that small march. We'll do a few more. And then bring the feet down slowly with control. And then your option for whatever clearing technique feels best for you. I like to do a little windshield wiper here after doing that 90-90 tap. And we'll do one more round. So pushing into the heels for the bridge, lifting the hips, or just a glute set where you tighten your hip muscles as you push into the heels, or the bridge if you're ready to progress and make things a little harder. And if you want this to be even one step more challenging, you can put your hands on your hip bones to make sure they're not moving or dropping as you straighten one knee out. What will tend to happen is that knee that you're trying to straighten, the hip will try to drop, So you really want to try to keep the pelvis nice and level, and then you can alternate switching. If that causes pain in the low back, maybe you hold off on introducing that, but that's an option to make this a little harder, or you can just hold and breathe, or you can just keep the hips down and do that glute set and breathe. Slow and controlled, release that. And then a clearing technique, windshield wipers. You can hug one knee up to the chest at a time, or the self-massage might feel nice with the knuckles along the spine here. And then I'll have you roll onto your side, and with your arms out in front of you, you're going to lift and bring one arm all the way up and over to the side. Take a breath or two here, and then come back. And again, twisting, opening, turning your head with the arms, and then come back. And then we'll switch to the other side. With the arms out in front to start, and then up and over, twisting, turning your head with the arm, and then back. And then from here, we'll go into a hands and knees position. And then inhale, cow pose. As you look up, allow the belly to drop down. And then exhale, rounding the spine, arching the back, allowing the head to drop. Inhale, looking up, let the belly drop, anterior pelvic tilt. Exhale, pull the belly button towards the spine, posterior pelvic tilt. As you allow the head to drop, the back will arch. And just cycling through this cat-cow for a few rounds. And then next we'll do a few bird dogs. So you're going to lift opposite arm and leg and reach towards opposite walls. So you're trying to create length as opposed to lift. So you're not necessarily trying to lift really high and arch your back. It's more about the length, so that reaching towards opposite walls. And that's going to help to cue the multifidi muscles, which help to support the spine. And then lower back down, and we'll switch sides. Opposite arm and leg reaching towards opposite walls. Breathing for a few cycles of breath, holding for maybe 5 to 10 seconds or 2 to 3 breaths. And then slow and controlled switch. We'll do 2 more on each side. Try to keep your pelvis level as if there was a glass of water on your tailbone and you were trying hard not to spill that glass of water. 1 more each side. Inhale as you lift. A few cycles of breath. And then exhale as you lower. Now tuck your toes. Place your hands a little bit further forward than your shoulders. Push into your index finger and then try to spin the creases of your elbow forward. So you're externally rotating the upper arms. That's going to help to engage the rotator cuff muscles. Pushing into the index finger will give you a little more grip on the mat. And then lift the knees and push up and back into a down dog. And we'll hold here for a few breaths. You can pedal out the heels. Try to pull the sits bones, the tailbone, up towards the ceiling, creating some length in those hamstrings. Remember to keep your neck long, so not shrugging the shoulders up, pushing into that index finger and spinning the creases of your elbows forward. You can come up on both toes, lifting the heels, and then as you exhale, let those heels melt back down towards the mat. And then slowly come forward, bringing the chest forward, the shoulders over the wrists for a plank pose. And we'll hold for a few breaths. Remember to keep pushing into the index finger and spinning the fronts of the arms forward. Keep the neck long. You can drop the knees down and do a plank here if that's a little more doable for you, but try to work towards that lifted plank. 2 more breaths. And then come back onto hands and knees, and then back into a seated position. And then you can lie back into Shavasana and snuggle your shoulder blades under you. Allow your feet to rock out to the sides, palms face up, hands a little ways away from your hips, far enough away that you can feel your armpit muscles and your shoulders relax. And we'll rest in Shavasana for a few minutes, just allowing the benefits of this very mindful, intentional practice to absorb. And you can place the tongue into the roof of your mouth and gently press into the backs of the teeth, and then allow the tongue to relax. And this will allow the jaw to release. Allow the skin between your eyebrows to soften and your eyes to soften. Looking down slightly helps to shift into more of a rest and digest state of mind. And bring your awareness to the scalp and allow the skin on the top of your head to just soften slightly. The back of your neck, allow the muscles to release and let go. Bring your attention to your shoulders, and if there is any tension holding the shoulders off of the ground or any gripping in the shoulders, just try to allow that to release with your next exhale. And then bring your attention to your forearms and your hands and allow any muscular engagement to soften. Allow the bones to just melt towards the floor. And then bring your awareness to your chest and your upper back and allow everything to release and let go and the breathing to normalize. And bring your attention to your abdomen, to your belly, where your hand was resting at the beginning of today's practice. And just allow the abdomen to soften and the low back, particularly the muscles of the low back, to release and soften into this relaxation in Shavasana. Allow your hips to release. Maybe doing a few breaths where on the next exhale you just allow those hip muscles to soften and let go, allowing your legs to rest in whichever way gravity is pulling them. Allow your thighs to release and soften. Bring your attention down to your calves and your ankles and your feet and allow everything to release and let go. And just be. On your next inhale, start to bring some movement into the hands and toes, allowing that movement to expand, allowing the breath to deepen as you start to reawaken the body with some gentle movement, just exploring the movement. And when you're ready, you can bring your knees up, roll to one side or the other, and then come to a seated position. And thank you for practicing with me today. I hope that this becomes a practice that you can lean on a daily basis to help you manage your low back pain. And by practicing regularly and bringing this into a daily routine, I hope that this brings you and provides you with some relief of your back pain. And as you move into that state of more and more pain-free movement and pain-free activity and posturing, then progress to part 2 of this yoga for back pain.